If you've been feeling wound up lately, racing thoughts at night, a tight chest before anything's even gone wrong, tired but wired, you've probably already heard someone mention ashwagandha. It's everywhere right now. Supplement aisles, social media, your neighbor's kitchen counter. And usually it gets talked about in vague terms. It helps with stress, it's calming, ancient herb, very powerful. That's not really information, that's a vibe. So today we're doing this properly. 7 specific things ashwagandha has been shown to do for stress and anxiety. Each one backed by an actual clinical study. Not folklore, not trust me, real randomized controlled trials with real numbers. By the end, you'll know exactly what it does, what it doesn't do, and whether it's worth trying for you. Quick note before we start. This video is for general education only, not medical advice. Ashwagandha can interact with thyroid medication, sedatives, and immunosuppressants, and it's not recommended during pregnancy. Talk to your doctor before adding it, especially if you're on any prescription medications. Let's get into it. 1. It lowers cortisol, your body's main stress hormone. Cortisol is the hormone your body releases when it perceives a threat. Originally meant for genuine emergencies, but in modern life it gets triggered by traffic, bills, arguments, and just general overwhelm. Chronically elevated cortisol is linked to poor sleep, weight gain around the midsection, high blood pressure, and a constant sense of being on edge. Multiple clinical trials have measured this directly. A randomized, double-blind, placebo-controlled study gave participants either a placebo or 240 milligrams of a standardized ashwagandha extract daily for 60 days. The result was a statistically significant reduction in morning cortisol compared to the placebo group, along with reductions in anxiety scores. This isn't a one-off finding either. A separate 8-week trial using doses of 250 and 600 milligrams per day found significant cortisol reductions at both doses, with the higher dose showing an even stronger effect. What this means practically? Ashwagandha appears to help regulate the hormone most directly responsible for that stress is running my body feeling. Not by sedating you, but by turning down an overactive stress response. 2. It reduces perceived stress, not just lab numbers. It's one thing for a hormone level to change on paper. It's another for a person to actually feel less stressed. Researchers measure this using something called the Perceived Stress Scale, or PSS, a standardized questionnaire that captures how overwhelmed and unable to cope someone feels in their daily life. A meta-analysis pooling data from multiple randomized controlled trials found that ashwagandha supplementation produced a significant reduction in perceived stress scale scores compared to placebo. Another independent meta-analysis of 9 separate studies covering 558 patients found the same pattern, a meaningful decrease in self-reported stress. This matters because lab values don't always match how someone actually feels day to day. Here, both lined up. People weren't just showing lower cortisol on paper. They were reporting genuinely feeling less stressed in their actual lives. 5. It's been studied at specific, measurable doses. One of the most useful things about the ashwagandha research is that it isn't vague. The clinical trials used specific dosing protocols, which means you're not guessing. Across the studies referenced today, effective doses ranged from 125 milligrams to 600 milligrams daily, typically taken over 8 to 12 weeks before researchers measured results. Others used combined root and leaf formulations. Why this matters? A lot of supplements get marketed with sweeping promises, but no real dosing clarity. With ashwagandha, there's an actual evidence-based range to look for on a label, and a realistic timeline. These are not overnight effects. The studies consistently measured results at the 8-week mark, not after a few days. 6. It's generally well tolerated, with real caveats. Ashwagandha was generally reported as safe, with minimal adverse effects, and dropout rates due to side effects were low. But generally well tolerated isn't the same as no concerns for anyone. Ashwagandha can affect thyroid hormone levels, which means it needs caution or avoidance for people with thyroid conditions. It can interact with medications for diabetes, blood pressure, and sedatives, and it can affect the immune system, which is relevant for anyone on immunosuppressant medication. It's also not recommended during pregnancy or breastfeeding. This is the part influencers tend to skip, and it's the most important thing in this whole video if you're on any medication. A conversation with your doctor or pharmacist before starting takes 5 minutes and removes the guesswork. 7. The research still has real limits. This is the part most videos about ashwagandha leave out entirely. And it's worth saying clearly. This is a genuinely promising body of research, not a settled slam-dunk conclusion. The meta-analysis covering 873 patients found significant improvements in cortisol, stress, and anxiety scores. But it specifically noted no statistically significant improvement in overall quality of life. In other words, the measured stress markers improved, but that didn't necessarily translate into people reporting their life was better overall. That's an honest and important distinction. Study sizes are also still relatively modest by pharmaceutical standards. We're talking about total participant counts in the hundreds across pooled studies, not the tens of thousands seen in major drug trials. The researchers behind these meta-analyses consistently call for larger, longer-term studies to confirm long-term safety and to nail down optimal dosing. None of this means the existing research isn't meaningful. Multiple independent randomized, placebo-controlled trials pointing the same direction is a real signal, not nothing. It just means promising and well-supported is the honest description, not miracle cure or proven to fix anxiety. So to recap, across multiple randomized controlled trials, ashwagandha has been shown to lower cortisol, reduce perceived stress, reduce clinically measured anxiety, and improve sleep quality, typically at doses between 125 and 600 milligrams daily, over 8 or more weeks. It's generally well tolerated, but it does interact with certain medications and conditions, and the research, while solid, still has real limits worth being honest about. If you're dealing with chronic stress and you're curious about trying it, the right first step is a conversation with your doctor, especially if you're on thyroid medication, blood pressure medication, or anything for diabetes. If this breakdown was helpful, let me know in the comments which of these 7 surprised you most. And if you want, I can put together a follow-up video specifically on how to read supplement labels so you know you're actually getting a real, standardized dose and not a diluted product. Take care of yourself. This is Wellness Food Blog.